good morning. We'll get started. Thank you all for coming today, and thank you for joining us on TikTok. With technology the way it is, we have 70,000 followers on TikTok. So oftentimes we have thousands watching during one of these presentations. So thank you for coming and being here in person. My name is Marty Donovan. I'm a clinical nutritionist, pharmacist, and herbalist, and my passion is natural medicine. How do you help the human body to work normally rather than being drugged? So that's really kind of, you'll hear a lot about that today in terms of where medicine is completely different in the approach that the natural approach is. So today's talk is healthy digestion, and I need my pointer. Okay, so today we're going to talk about I never turned it off. It's on, but it's not. Let me try changing the batteries. The pointer worked, and it worked earlier when I...
That's fine. Let's try it now. That's so weird. Hold on. Just give me a second. All right, now try it. There we go.
Okay.
Sorry about that.
Technology works. Okay, so today we're going to talk about the basics of the digestive system. We're actually going to go through the anatomy of it so you can see what it looks like. What are some of the signs and symptoms of digestive problems that can happen? And that'll be all the way through the whole system. What kind of drugs and what do they do? And then how do we do this more naturally, lifestyle and getting the body into balance that way. So let's start with what does your gastrointestinal, GI's gastrointestinal tract actually do? Number one, it's involved in digestion. It breaks your food down into pieces that can be absorbed into your bloodstream, nutrient level things, and that's what nourishes our bodies and helps it to grow and keep healthy. Most of the digestion occurs in your mouth, your stomach, and your small intestines, although a little bit occurs in the large intestine as well. It's involved in absorption. Foods break down. They need to get into your bloodstream, so we need to absorb them. This happens mostly in the small intestine, which is kind of like the kitchen of your body. And then some in the large intestine, which is more like the septic system of your body. It's involved in elimination. You need to remove the waste from your large intestines in order to be healthy. Now, something that's interesting perspective to have as we work our way through here is that essentially, your inside is outside. There's an open tube from your mouth to the other end. It's not technically part of the inside of your body. Inside of your body would be around your organs and your bloodstream, in your brain, all those things. That's inside your body, and that's protected. We have a skin layer on the outside of our body, but we have a skin layer all the way through. It's almost like a tunnel that goes through us. So it's technically not part of us, it's outside of us. And so there's a lot of qualifying that happens, what's allowed to get out of that tube into your bloodstream. And that's a really important part of digestion. Certainly you want to absorb the nutrients you're eating. You don't want to get in bacteria, viruses, bad things that you've eaten, things like that. So it's kind of an interesting concept. And as we go through this, pay attention to the fact that there are valves and sphincters and closures that hold things in place for a little while, and then it moves on down. So it's kind of an interesting system, very, very complex. So we'll start in the mouth for digestion. First is mechanical. Your lips, that is one of the mechanisms holding things in this tube. If you didn't have lips, food would be coming out as you're eating. So this holds food in, helps to hold moisture in your mouth. The saliva glands release saliva to moisten, to soften, to even begin, the digestion begins here too. Your teeth reduce particle size, they crush things up, they get them into a form that is more easily absorbed. So when you're eating, chewing your food thoroughly is part of digestion. So if you have digestive problems, it may be partly due to just not eating your food properly. Your gums protect your teeth, again, which are critical. Your tongue actually pushes food back to the top of your throat so it can be swallowed. The uvula, which is the thing that hangs down to the back of your throat, that prevents food from backing up in behind your nose. And then the epiglottis folds over your windpipe so you don't inhale food down into your lungs. There's sensing involved in digestion. Your brain is first. There may be no food around, but you're thinking of it, and you're getting hungry, or your stomach's rumbling, things like that. Certainly your nose smells food, begins to get you primed to digest. Saliva increases during that time, and your tongue tasting food. That lets your intestinal system know, okay, something's going to be happening. I need to get to work here. There's chemical process involved. Saliva is released from your salivary glands. Again, that moistens, softens food, but there's also actually enzymes in saliva that begin the breakdown process, which is where thorough chewing is really important, to be able to mix the food and get the enzymes at those foods as well. Then we've got, here's a little video of when you eat and then you swallow, and now the food is going down, and the lower esophageal sphincter, which is where just between the stomach and the esophagus, that's what keeps things from backflowing upward. So digestion in the stomach, you swallow food with your voluntary muscles. So at this point, you're active, you're chewing, and you're physically choosing to swallow. Once you swallow, then involuntary takes over. They call it peristalsis, where this tube is actually lined with muscles, and they rhythmically contract and relax to move food downward. So you don't even need to think about, when you're eating your meal, that I have to be sure that this is going to get down into my stomach. Your body does that for you. So the food goes down through that lower esophageal sphincter, and then the lower esophageal sphincter, again, is important to keep food from backing up, regurgitating upward. Before the food enters the stomach, basically it's at rest, and there's enzymes involved in digestion that are not functional yet. Once food is in the stomach, then the stomach begins to release acid to begin the digestive process. The pH of stomach acid is around 1.5 or so, which is equal to battery acid. So this is not a small thing. I mean, you're eating a piece of steak and it's being broken down. Another major function of stomach acid is to kill bacteria, things we swallow with our food. This is actually our first line of immune defense. And so if you have low stomach acid, which we'll talk about later, you're actually more prone to infections. And also part of the role of stomach acid is to begin to change protein digestion and get that going. There is a release of enzymes to some level at this point in the stomach. The stomach begins to churn, and you actually have a mucus layer in your stomach to prevent you from digesting yourself. So it's kind of interesting that here your stomach is flesh, and yet you're digesting a steak, which is flesh. And this mucus layer is really complex. It's really, really thin. And here you have the stomach acid is 1.5, which the pH scale goes from 1 to 14. Neutral is 7, that would be water. Below 7 is acid, above 7 is base, alkali. And so stomach acid is right at the low, strong end of stomach acid strength. The lining, this mucus lining, just below that, the pH is 7. So within the stomach itself, it's protecting itself from that. So this is a little look at the stomach with food in it. You look at the sphincter holding the food down, the lower esophageal sphincter, keeping the food from backing up into the throat. You've got the action of digestive juices like stomach acid and enzymes. You've got the pyloric sphincter, which is at the other end of the stomach, waiting to release the material further down into the intestine. So this is like bottling it up so it can do its work. and then the muscles mix the food. So in a visual, this is what it looks like. So it's your own little blender going on in there. So then we move out down into the small intestines. Again, we're moving down this tube from the stomach into the small intestines. First, you have the duodenum, which is the beginning of the small intestines. The food enters that. This triggers the release of other digestive factors. You have your liver involved, and that releases bile. Bile is actually released into the gallbladder, which is like our urine bladder. It stores. When the demand for digesting a fatty food occurs, then the gallbladder contracts and bile comes down into the intestines to help with processing fatty things. Your pancreas releases a variety of enzymes that help with digesting fat, carbs, and proteins. And there's also a release of bicarbonate, which is neutralizing to stomach acids. The stomach wants to be high acidic. The intestines don't want to be high acidic to do their function. And that's mainly how enzymes are activated, is in the acidic, or in the basic area. So the digestive enzymes complete the digestion of the carbs, fats, and proteins, and they break those down into nutrients that the body recognizes as being feeding it. And here's an example of some of those. You have the carbs, you're eating a piece of bread, and then some of the carb digesting enzymes like amylase, sucrase, isomaltase, maltase, and lactase. Lactase, again, that would be the one that breaks down milk sugar, as an example. You then get the sugars that come from that, the glucose that goes into your bloodstream. Next, you have protein, and there are enzymes called protease enzymes that break down protein, pepsin, trypsin, tryptase, and then from those you get amino acids. So the protein is not the nutrient source, it's what it's made of, which is amino acids. That's what we absorb. And then you have oils, and you have the action of lipase, but also the action of bile, and that creates the fatty acids and being able to absorb those. So it's a pretty intricate process. So in the small intestines, there's a lot of absorption that goes on there, a lot of digestion and absorption. Again, I like to call it the kitchen of the body. This is where we want stuff that's in there to get into our system. That's what nourishes us. Most absorption occurs in the 15 feet of the small intestines. I mentioned this tube from beginning to end is probably about 20 to 25 feet long, and that's all inside us. Most of it is in the small intestines. Again, 15 feet of it is right here. So it's, again, a lot of surface area for absorption. The intestines are interestingly designed as well in that you want to have maximal absorption in a short amount of time. So there are the intestinal lining has folds that are called villi, and these help to give more area of absorption. So there's one, it shows the opening in the intestines, and then it shows one example of that. So that's what that whole ring there is lined with these. When that is working properly, the surface area of absorption is 430 square feet. That's like a 21 by 21 room. That's how much room we have in our intestines to absorb the food that we take in. So then, absorption and elimination, things move down into the large intestines, which again is more like your septic system, getting ready for you to leave your body. The food enters the large intestine through the ileocecal valve. So again, there's another valve that separates the small intestine from the large. You do not want your large intestine, which has E. coli and all this stuff going on, you do not want that backing up into your small intestine. So that plays a very important role. The large intestine is now storing the material that we've been eating and is not going to get absorbed. That's where mainly fiber comes into play. That's why we eat fiber, to keep regular. And the large intestine is actually about 5 feet long. Now, you may say, well, if the small intestine is 15 feet long and the large intestine is 5 feet long, why is the large intestines the large intestines? Because it's the volume, it's the diameter of the actual intestines they're talking about. And in the as well down here, large intestines, you've got absorption of water, major absorption of water. That's what normalizes your stool. Things are moving in as a liquid through this whole process. Now they're getting into the large intestine, it's getting close to time to leave your body, and you want to have a formed stool. So you've got to remove a lot of water. So that's where absorption of water happens. That's a major deal with some people who don't drink enough water. They get constipated because their body keeps drying it down to preserve body water. The other one is we do make vitamin K. It's actually the good bacteria in our body manufacture vitamin K also down here. The inside here as well, you might have heard of the friendly flora, the probiotics, the microbiome. There are trillions of these in our gut and throughout our whole body. They actually make up a major portion of our immune system. About 70 to 80% of the strength of our immune system is from these good bacteria. They're the ones standing between your insides and your bloodstream, and they help to qualify what is allowed into your bloodstream. They're part of your digestive system. For instance, you know that they take milk and they put probiotics in milk and make yogurt out of it. Well, that's the lactase I mentioned earlier, the enzyme that breaks down milk sugar. So these good bacteria are critical for healthy digestion. They make the vitamin K I mentioned earlier. They actually bulk our stool. If you're deficient in these good bacteria, by repleting or putting in what's adequate, you may double the amount of stool you produce every day. It's just the life and death of the organisms themselves. And the probiotics have had huge research in many, many, many areas of our health. They're really important for our mental health. In fact, they call your gut your second brain. Might have heard of a neurotransmitter called serotonin, which is a feel-good hormone. There's more use of serotonin in your gut than there is in your mind. So it's a really big deal. It's involved in maintaining healthy weight. So the probiotics have a huge role in good health. Okay, so here's the fun part. Looking at your stool is really important. You want to think of your stool as a report card for what's been going on inside of you. So I would strongly encourage people, make sure you're looking at your stool and evaluate it, and this will give you a tool to know what you're looking for and looking at. So again, your colon is absorbing water to form a solid stool. Your rectum stores the stool. There are pressure sensors as you fill that make you feel like, okay, I have to go to the bathroom. And then a description of the stool should be soft but formed. It should bend in the toilet, but it should be formed. It should be the normal, typical brown color that we think of. It should not be white, red, gray, black, or yellow. There shouldn't be any food present. In other words, you might see little pieces of corn or peas, but you shouldn't see lettuce or carrots or things like that, or meat. And in terms of how much is healthy, about 2 feet per day is good. If you eat, we'll talk about healthy diet. If you eat a diet the right way, usually you will produce that. And then here are some examples of pictures. The goal here is type 4 on the Bristol. Believe it or not, they have a chart, the Bristol stool chart. Number 4 is smooth, soft, and bends in the toilet. So like a sausage or a snake, you go to the left and you're going harder. So type 3 has cracks in it that would show that it's dried out, and then you get lumpy and you get even little hard nut-like characteristics of really severe constipation. And then going the other way, you have number 5, which is kind of soft, extra soft, but still kind of formed. That's not bad, but the ideal would be number 4. Then going to 6 and 7, you're getting looser and looser. 7 being the worst, where you're putting out a lot of water and you're putting out a lot of electrolytes and you're losing a lot of nutrients. Things are moving through you too quickly. Your system is not designed to be able to absorb rapidly, and this is moving through you too fast. Okay, so some of the keys to supporting the GI, first of all, is balance. Our GI tract is made for a specific pattern of eating. Unfortunately, most of the American diet is not for that. Helping your GI to get the support it needs involves paying attention to what your symptoms tell you and understanding why they occur. We'll talk a lot about those in a minute. Giving yourself what you need and supplementing what you can't easily get from today's food. So let's look at the actual imbalances now that can occur in this really complex system. We'll start with the upper area. Some signs of a unhealthy upper GI would be things like heartburn, indigestion, bloating in the stomach, burping, stomach pain, cough, reflux pain, clearing the throat, bad breath, changes in singing voice, esophageal erosion, dental erosion, abnormal endoscopy findings, feeling of acid in your throat or mouth. Most of these are related to, would be considered to be GERD, which is gastroesophageal reflux disease. That means things are moving back up from your stomach into your throat. And there can be a wide variety of symptoms related to this. Some of them are not so subtle, like heartburn and indigestion and burning. Others are very subtle and maybe not even paid attention to, like cough, or my singing voice has changed. So the problem with this is that our throats are not designed, they're not protected from stomach acid. So a continual reflux up into your esophagus can cause health problems. So there can be problems in the mouth starting, to where does this problem start? It could actually be anywhere along the line, but in terms of the mouth, it could be due to low amounts of saliva. You don't have what you need to start the digestive process, to moisten your food, and that could be because you're not drinking enough. You don't have enough body water. It could be that you have a problem with your salivary glands, and that might be a medical problem that would probably need to be looked at. And there are health diseases as well. Sjogren's is one. It's chronic dry mouth is one of the symptoms of that particular disease. It could be mechanical, like difficulty in chewing or swallowing. Maybe you have trouble with your teeth in some way. Maybe you have trouble with your nerves and you're not able to swallow properly. TMJ would be it's called temporomandibular joint, and that would be an anatomical structure. The bones of your jaw are not aligned properly and they're giving you trouble chewing. And then there can be strictures and obstructions that might keep you from being able to swallow. They're constricting you, preventing you from swallowing. So dysfunction in the stomach, the heartburn, the acid regurgitating into the esophagus, and it can be possibly due to incomplete digestion, meaning you don't have enough stomach acid to finish the digestive process. It could be due to hiatal hernia, again, a medical problem. It could be due to pregnancy, again, hopefully temporary, obviously, but it can be a real problem for pregnant women. What you're eating matters, what lifestyle you have factors matter, and then you can truly have producing, for some reason, way too much acid. Your stomach is on autopilot. It will evaluate, okay, we had this size meal or we had this complexity of meal. We need this level of acid to do this properly, and it gets it right most of the time. Sometimes there's a defect and we're actually producing too much acid, which can create that problem. So this is just an example of what that reflux looks like. Again, a little visual. You can see the fluid in the stomach is just splashing up into that, the sphincter being open that allows that to happen. Okay, so this can lead to, some of these problems can lead to, I mentioned that can be the GERD, which is gastroesophageal reflux disease, meaning you're continually refluxing upward, and that acid can cause damage. One of the damages is called Barrett's esophagus. That's considered to be a precancer condition. The acid actually damages the cells, and it can lead to cellular changes that could eventually lead to cancer. There could be coughing, choking, changes in your voice, pain, and then it can even involve asthma. You can reflux and then breathe it in, so it goes down into your lungs, and that can damage your lungs. So in the stomach, some of the issues, in addition, would be peptic ulcer, and that would be H. pylori, which is an infection. One of the kind of interesting things in medicine, like when I was in pharmacy school back in the 70s, all ulcers were caused by stress. That was the main reason. Then they discovered, it's actually an infection. It called H. pylori. And so now they treat ulcers with antibiotics. One of the reasons for that being able to survive can be low stomach acid. You don't have enough stomach acid to kill these things that should not be living in your stomach. You could also have gastritis. That could be inflammation in the stomach caused by a number of things. It could be your diet, infection, incomplete digestion, medications. And then another condition called gastroparesis, which is just slow emptying of the stomach. So the GERD, we'll talk about that a little more. That's a very common one that people deal with. You see prescriptions for, you see commercials for Prilosec and Nexium and Tums and all these different things all the time. So these people are dealing with some level of reflux, the people they're marketing to. So one of the reasons this can happen is you truly do have too much acid. Another could be you have too little acid. The stomach produces less over time, meaning it could be due to our age. It could be that the acid we had got neutralized. If you're drinking milk, milk neutralizes acid. If you're drinking a lot of fluid, it dilutes the acid and lowers the strength. And when we're under stress, we don't make as many digestive juices as we need to because your body's more concerned about keeping your heart beating and your blood pressure up and managing stress and all these other things. And so the other systems of your body, like relaxation, digestion, defecation, they all kind of go to sleep. So stress has a major impact on this whole digestive system. There can be things that are irritating the system and mainly due to lifestyle. Having too much food at once. In other words, you've eaten a lot of food and you just don't have the digestive power to process it. And especially if you eat it late in the day and then lay down, usually it should be 3 hours before bed to have a big meal. You just don't have the time to process it. Certain things that can cause the valve to open or relax it, alcohol and caffeine are two primary ones. The esophageal sphincter, they actually relax it and allowing it not to hold down what it should be holding down. And then sometimes acidic foods just add a little more acid that you're refluxing upward. Bad bacteria can be an issue, like say with food poisoning. And then carbonation and gulping air. When you have a lot of air in your stomach, that's more pressure to open up the ileocecal valve. So you want to not gulp when you eat and trying to avoid, if you have this problem, try to avoid carbonation or frothy shakes or things like that. And there can be real physical reasons for this. One would be a hiatal hernia, another pregnancy. There can be abnormalities in the sphincters themselves, like the lower esophageal sphincter and pyloric sphincter, those types of things. And then when you have extra body weight, it's difficult for these internal systems, and they can sometimes malfunction because of that stress. We're going to talk about drugs now, and the two things that drugs focus on with reflux and ulcer is too much stomach acid and bad bacteria. So in terms of determine what exactly is going on, do you have too little acid or too much? Again, the drugs like Prilosec are assuming you have too much acid. The question is that correct? The way you discern that is by looking at your symptoms. Yes, you have heartburn. In both cases, whether you have low acid or high acid, you still have acid in your throat, which hurts. So when do your symptoms come on? If symptoms come on after the meal or they arrive at night, that means you actually have too little acid, that you're not digesting properly, you're getting irritation from the food, stress, maybe too much air. So the bottom line with this is you eat food and it's in your stomach and it's not getting digested. There's not enough acid there. It sits there and now it begins to be fermented by the organisms you couldn't kill with your stomach acid. So the yeast and bacteria, they're in there and they're causing fermentation, which produces gas, which fills the stomach with air, which then opens up the valve. So that takes time. So it's 20, 30 minutes after the meal, it's laying down at night, and you shouldn't have food in your stomach when you lay down at night. And a lot of people have food in their stomach throughout the whole day because it never leaves. So this is one possible reason for heartburn.
Is that also like in the morning? Like if you wake up in the morning and you feel it, like you have nothing in your stomach?
You still have food in your stomach from last night.
Okay, so that would still be low acid.
Correct. Correct. Yeah, if you have food in your stomach in the morning, that's low acid. You did not clear. You should. It should be complete digestion. It should leave. Your stomach should be empty. It shouldn't be there to reflux.
How long does that typically take if you've had a meal? Depends on the size of the meal, I guess. But
How long before you see a symptom?
no, like for your stomach to digest the food that you
The definition in pharmacy of an empty stomach is 2 hours after a meal. Most Americans, it's longer than that because of this problem. So, the other would be if you actually get symptoms during your meal, you're getting heartburn while you're eating, or pain goes away during your meal. With the coming on during the meal, that would be high acid indigestion, and that could be an anatomical issue. For some reason, you're just making too much. It's not, your body's not working properly. It's not something you've done to induce it. It's not working properly. And then if you get pain that goes away with a meal, that could possibly be an ulcer, and that's again relates to the H. pylori and maybe the need for an antibiotic. So with that case, you want to see your doctor. So in terms of what do most people see, the top one. Most people who are being treated with drugs to lower their acid already have too little acid to begin with. And what they do, though, is they just reduce the acid further so you're not refluxing. That's all. They're just they're helping to calm a symptom. They're not dealing with the underlying problem. And I'll talk about the side effects of that when we get to in just a minute. So how do these drugs do this? How do they lower your acid? One, you can use antacids. That would be things like Maalox, Tums, Rolaids. They neutralize acid in the moment. So if you had to use any kind of an acid reducer, this is the least harmful. Do you have a question?
Yes, from here. They asked, what if you have heartburn when you haven't eaten at all for quite some time?
It's hard to guess, but I would say there's probably still food in the stomach. But there may be other issues going on. Okay? So these neutralize acid in the moment. You have heartburn, you take it, it's like just dampening down, neutralizing the acid at that moment. Then you get into the drugs that actually change the way your body makes acid. One class called H2 blockers, and that's Tagamet, Zantac, and Pepcid. And then the stronger ones, proton pump inhibitors like Prilosec, Nexium, Prevacid, and Protonix. They're actually inhibiting your ability to make stomach acid. So they're reducing how much you will produce. The Tagamet and Zantac are more light to moderate. The proton pump inhibitors are severe. They can almost even shut down completely your stomach acid production. So these are really, really strong. Side effects, this relates to poor digestion. You digest for a reason. You're releasing acid for a reason. You need to have acid to help you process your food properly. Big deal is how do you absorb minerals? You need acid to absorb minerals. So some of the side effects are bone loss, increased risk of hip fracture, which would include osteoporosis, infections, because you're not killing the organisms you're swallowing, and two common ones and really big problem ones are pneumonia and another one called C. diff, which is a really severe intestinal infection, causes severe diarrhea, and even can put you in a nursing home. Muscle cramps, because again, not absorbing magnesium well, deficiencies of calcium and magnesium, B12, you can have dementia, neuropathy, thyroid problems, and diabetes. So there's a bunch of problems that can be provoked by lack of ability to have the nutrients that are needed to help keep those conditions in check. So what kind of lifestyle changes do we look at in order to help your upper GI area? For your diet, number one, try to avoid some things. Mint relaxes the lower esophageal sphincter, allowing you to reflux. Caffeine, that would be like peppermint tea, can do that. Caffeine and chocolate do the same thing. Alcohol, tomato and citrus are often just mildly acidic, and they add more acid for you to reflux. They're not enough to digest your food. They just add more to it, and smoking affects that as well. Drinking plenty of water between meals helps to make your digestive juices in balance. You need water to make your digestive juices. So if you're dehydrated, then digestion may be inhibited with that. When you're eating, only have a half a cup of fluid with your meal so you don't dilute your stomach acid. It's good to have fermented foods, sauerkraut, yogurt, things like that. These contain probiotics, which again are part of our digestive system, and try to avoid excessive carbs and fats. Yeah.
So like sauerkraut, it's kind of acidic?
Okay.
and what was happening. So did the sauerkraut help or harm that gut flora?
It's not a matter of harming the flora. It's filling your stomach with something you may not be digesting well. Generally acidic foods like tomato sauce should not cause a problem for people if your digestion is normal. But if you are on the edge of indigestion, then yes, that can add a little more in there. Antibiotics can induce that. They can induce low stomach acid by killing the good bacteria that are part of your digestive system.
Right, so if I had already started out with low acid and then I got on the antibiotics, that would...
It can make it worse. Yeah. So I would, in those cases, you go by how you feel with the food you're eating. But in general, probiotics, like would be in sauerkraut, are supportive of that. Although they're not really high, and they won't overcome an antibiotic wholesale killing of good bacteria. You really need a supplement to overcome that. Okay, so some eating habits, chewing thoroughly, eating small to moderate sized meals, not gulping air and avoiding air consumption like carbonated beverages. Try not to lie down before about 3 hours after eat until 3 hours after eating. Stress, I mentioned earlier, stress stops your digestive system. So you need to relax. You need to sit down, eat slowly. We digest when we're at rest. You can't, run 100 miles and eat at the same time. Your body is designed not to allow you to do that. And then certainly reducing weight, because that's also involved in reflux. So some natural approach to indigestion and supplements. The QR code is in the bottom right, which shows the products that I like. But first would be to supplement with the actual digestive supplements that are part of our normal digestive system, which are stomach acid, enzymes, and bile. And so OrthoDigestzyme contains those, the betaine hydrochloride, enzymes, and bile. The dosing on this is you need to figure out how deficient you are in stomach acid. So if you're having this post-meal reflux, you start by taking 1 capsule with each meal. And then you're going to evaluate. You don't have to wait 2 days to find out. You find out right away. Did that give me enough to finish digesting my meal? So you take it with your meal. If you have no symptoms after the meal when you normally would, then that may be the right dose for you. If you still have a symptom, maybe it's less or it's the same, then next time take 2. And if you still have it, next time take 3. So you're working your way forward. Most people don't need to go above 3, but you just go by what your body needs. It's really talking to you. So if you eat and you have a symptom after a meal, it means you need something. And then once you get it under control, you can adjust your dose up and down and see how you do with that. Now, on the other hand, if you take a dose, especially as you're increasing, and you feel heartburn during your meal, that means you've gone a capsule too far. And just have a Tums or drink some water, and that'll put that out. So you're really looking for no symptoms. Other things that can confound a little bit, it takes more to digest heavy protein, like pork, beef, ham, lamb, those kinds of things. They just take more. So you may find a heavier meal might take it. And certainly if there's more food, you need more than if it were a small meal. Along with that, deglycerinated licorice. This is a true herbal black licorice. The DGL means they've removed one component that potentially could raise blood pressure if you eat a lot of black licorice, true, real, not the anise kind of stuff we get in this country, but the real black licorice candy a lot. You can raise your blood pressure by the nature of what the herb is doing to you. So they remove that part so you can use it freely. So with heartburn, chewing one of these not only helps to quench the burn like Tums does, but it also helps to soothe and heal the irritation caused by the acid. If you've been dealing with this for a while and you know you have irritation, or maybe you've been scoped and the doctor says, okay, you've got irritation, then what you want to do is take one of these tablets, they're a chewable tablet, but don't chew it, put it in your cheek pouch, let it slowly dissolve. It mixes with your saliva, and as it dissolves, you're bathing your esophagus with this soothing herb, So over the 5 or 10 minutes it takes to dissolve it, you do that, and maybe do that 3 times a day. It can even help to heal up an ulcer, work on healing an ulcer. And then I mentioned earlier, probiotics are very important for digestion, and the orthobiotic is the one I like, generally dosing 1 capsule at bedtime. Okay, let's get into the lower area. Yeah.
I came to you a bunch of years ago, and I had some of those symptoms, and this is where you gave me the Vetane and the liquid,
Uh-huh.
and it worked beautifully.
Wonderful.
It worked. People have never had trouble again.
Yeah.
Yeah, I still have a bunch of it because I didn't use it all.
Okay. Yeah.
It really helped, and I really appreciated the fact that I didn't have to take other meds. And you explained that too much acid and too little acid, like what over-the-counter things do.
Yep.
It's completely opposite
Mm-hmm.
of what it's supposed to be doing, and I didn't understand that. I mean, I didn't realize that at first, and you explained it, and it really was really helpful, and I appreciate that.
Oh, good. I'm glad you got relief. I dealt with probably 500 people over my career, getting them off Prilosec and things like that, just with this simple thing. And it's just amazing how doctors don't go there.
Tell you to be low acid. They were just like, oh, you're having these symptoms? Here, take this.
Yeah.
It gave me a whole
Yep.
bunch of freebies.
Yeah.
I didn't want to take them. So I'm like,
Yeah.
I have to do something else. This is
Yeah.
what I want to do.
Now, the nice thing is you don't need to be diagnosed. You can go by your own symptoms. If you're getting symptoms after the meal, then you have a better clue as to what's going on. So getting into the lower area, some symptoms are constipation, diarrhea, intestinal bloating, cramps and spasms, intestinal pain, flatulence, frequent infections, discolored stool, mucus in the stool, blood in the stool, diverticulosis, which is outpouchings in your intestinal tract, which are oftentimes due to straining at the stool, like chronic constipation. And then diverticulitis is those, but they're infected, and hemorrhoids. So in the small intestines, some things that could be going on about why do we have these symptoms. It could be lack of the digestive enzymes like bile. Then that leads to intolerances, incomplete digestion. So the consequences of these not being there are not just limited to that area, but you're not absorbing the food you need to. You can get gas, pain, cramping, bloating. There's something called leaky gut. If you look at the picture on the left, you're going to see this is the cross section of the intestines. You have the cells above, and then you have the bloodstream below. Our intestines are only 1 cell thick. It's kind of amazing, but this 1 cell thick. And they are linked together like a fence. And they need to be tight like that in order to prevent things from getting in. So with a normal, the one on the left, you have what it looks like and what it should look like. The one on the right, you can see there's gaps between the cells. That then allows things to travel without being qualified down into the bloodstream. In the healthy one, the villi is involved in there with absorption. Things are going through the cell to get into the bloodstream, and that's where you're not allowed in. Get out of here. Okay, well, I want you. Let's come on in. And that's how we are normal regulating this. With this bad situation, it's a leaky fence. Things are getting in, and there's a whole variety of things waiting. The bad bacteria, there's toxins, there's viruses, all kinds of things are doing this, and this is a very, very inflammatory condition. So the leaky gut can be caused by, meaning damage to this tissue can be caused by diet, lifestyle, infection, probiotic imbalance, celiac disease. Celiac disease is where those villi that are, so many of them, they get flat. So you lose all your absorption surface. And this can lead to autoimmune diseases. A lot of doctors will say, we don't know why you have this autoimmune disease, thyroiditis or lupus or rheumatoid. One of the really strong, I think, ways this can happen is that when you're breaking down protein, it's being disassembled. There's a bunch of amino acids that make up one protein. It's being disassembled randomly, and these amino acids are coming off. And it shouldn't should be absorbed are the amino acids, not the protein until it's small enough. If you have these openings, you can actually absorb those particles that are not yet fully digested. So when they enter the bloodstream, the body says, what is this? So it sends antibodies against it to kill it. So that's how you get what's called a certain type of food allergy, a delayed food allergy. But if that structure looks like you, that antibody is programmed now against your tissue. And type 1 diabetes is a common example of this. It's related to a milk allergy in kids. Milk is very similar to the pancreas, and that can provoke type 1 diabetes in kids as an autoimmune disease. So that's leaky gut. So this is serious. So here's a little more about this bad situation. You got the dysbiosis. They call it. Dysbiosis means bad bacteria. Probiotic means good bacteria. Dysbiosis means bad. So you have these bad things there. They're damaging the wall. You have poor digestion going on. You may have lactose intolerance. With the damage to the villi and the wall, your absorption is now off. You've got diarrhea. Your body's trying to expel this stuff that it sees as danger, so it's ramping up removal through the system. You're not digesting your food properly, so undigested food ends up in your stool. You've got damaged tissue. You can also have constipation. The damaged walls and the nerves are not working well, so things are not moving through the way they should. And then again, you got the autoimmune potential with leaky gut. And again, I mentioned before, your gut is your second brain, so this will affect your mind. There's no doubt about that in terms of stress, depression, anxiety, a bunch of other things. It's really closely linked to the health of your gut. Okay, so problems in the large intestine. Got constipation, diarrhea, IBS, which is irritable bowel syndrome, which is where your system is moving either too quickly or too slowly. Either diarrhea or constipation are common for those. IBD is inflammatory bowel disease. That would be things like Crohn's disease and what's the other one? Ulcerative colitis. Just drew a blank. Dysbiosis, again, the bad life growing in there. Dysmotility, it's not moving the way it should, either too fast or too slow. And then the diverticuli, which are the outpouchings in the intestines, which can be just there, which is the osis, or the infected, which is the itis. So why do some of these happen? Number one, it can be something going on with the anatomy of your body. You have improper digestion. There's not enough enzymes, like lactose intolerance is one example of that. Not enough bile, especially with gallbladder removal. So when you have a gallbladder gone, that is a major problem, because now you used to have a storage of bile that you needed when you're digesting a fatty meal. So what happens is you have your liver, you have your gallbladder, and you have your intestines. And normally the liver stores bile, and then you release it when you need it for digestion. With no gallbladder, you're straight lining. You're just dripping bile into your intestines all day long. For some people, that creates diarrhea. A great remedy for that is psyllium seed, having maybe a teaspoon with each meal, and that helps to sop up that extra bile. But the other complication is you don't have enough bile at the time you're eating a fatty meal to process your food. So taking a good bile supplement, the orthodigestzyme contains ox bile, which is basically identical to human bile, to help you process that meal. So that can be a problem. And then certainly an imbalance in gut bacteria is a major issue. Some things that are illnesses or physical issues that can then bring on some of these issues: celiac disease, inflammatory bowel disease, pregnancy, the gut dysmotility, meaning it's just not working in the right way, and then again back to the imbalance in the good bacteria. And then lifestyle factors, eating patterns like eating too fast, not chewing well, eating too late in the day. Stress, again, shuts down your digestive system, and unfortunately, as we get older, we also don't digest as well as we did when we were younger. Food poisoning, we swallow organisms every day, every meal, ever eating something, we're always swallowing, bacteria, viruses, things like that. Normally, our digestive system will kill it. But sometimes it's either resistant to that or there's too much of it coming in, and then you end up with real, true food poisoning. And again, an imbalance in gut bacteria is a strong part of that. So in terms of the drugs, we talked about the drugs for heartburn and things. How do the drugs go treating constipation and diarrhea? Generally, they push you in one direction to the point of causing the opposite problem. So with constipation, you've got the stimulant laxatives like Dulcolax, Oxalax, Senokot. They actually stimulate the muscles to move things out. Again, you take too much of it, you end up with diarrhea. Colace softens the stool. Metamucil Citracel, these are the least offensive. They're not good products, but they're at least bulk, and they do bulk the stool. Milk of magnesia, Miralax, they draw water into your gut. Anytime you're reliant on a laxative, you can become reliant. You can truly become addicted to it. Your gut won't work properly like the stimulant laxatives. You can be, so even if you're, let's just say you had a temporary problem and you took these and then you kept taking them. Now you try stopping them and you can't not be on them because they've created a dependency. You still will have constipation even when you shouldn't have it.
Are there ways to fix that? Like I know a child that has been on like Miralax forever because she has issues.
The supplements I'll talk about will do that. Okay. So the other end would be diarrhea. Imodium is the most common one. That slows down the rate at which your gut is moving, so you have more time to absorb the water. Pepto-Bismol, calpectate are generally actually anti-inflammatory, and they calm down inflammation to help reduce the diarrhea. And these are directly related to aspirin. They're an aspirin-type product. So how do you care for your lower GI? We'll talk about pay attention to the patterns of your symptoms. Are there certain things that are triggering it? If you have milk, are you running to the bathroom? If you have gluten, those types of things. Look for symptoms, things within your own diet or within your own control that you can see if this is part of what's going on. If you're not aware, if you try doing that and you're still not going to see what's going on, you can try just eliminating some things for a period of time. Generally pick the foods you eat the most and avoid them for 2 weeks. Eat other foods instead. There's something called a delayed food reaction, and the more you eat it, the more likely you are to have a delayed food reaction, and you don't know, it doesn't happen immediately when you eat it, it may happen a day or two later, and it happens usually with the foods you have the most in your diet. So the top 3 in the US are milk, eggs, and gluten. So unfortunately, that's the nature of that. You can also be tested for food sensitivities. That helps to give you, this is a true antibody test for these kinds of allergies. With constipation, diarrhea, you want to try to have plenty of fiber. Fiber is really, really, really a big deal. For diarrhea, I prefer using psyllium husk, and for constipation, I prefer flaxseed meal. They both absorb moisture. They gel up in the presence of fluid. The psyllium really just does that. The flax does that, but also is rich in oil, which acts like a lubricant and softener, so I prefer that one more for people with constipation. Make sure you're having plenty of water. Again, hydration is important, about 2 quarts a day for the average adult. That's what keeps you from producing constipation. You're not absorbing the water to keep it in your body. And when it talks about working your way up to 35 grams a day, that relates to fiber. The average American diet has about 5 grams of fiber in it, and you need to be 35 or more. So the more fiber, the better. That's what creates the 2 feet of stool that I was talking about earlier. So it really is very, very important for both of these conditions to have adequate fiber. Again, staying hydrated, make sure you're getting plenty of water, eating the fermented probiotic-rich foods, avoiding artificial sweeteners like aspartame, sucralose, saccharin. Carrageenan is in a lot of products. It's actually like an intestinal irritant. It's found in most ice creams, most processed dairy products. This is a really big deal. In the lab, they use carrageenan. They put it into rats to induce ulcerative colitis, so they can use drugs on them to see how their drug can help them. So this is in our food. So It could be. Yes. Yeah. It's not in regular milk,
Right.
but most processed milk products it's in, and a lot of others as well. Look at your. The interesting thing is it's actually a natural product. It's a seaweed, but it's a really irritating one. So just because it's natural doesn't mean it's good for you. Polysorbate 1680 fall into that same category. Cellulose gum as well. And then there's another class called sugar alcohols. Erythritol, sorbitol, and mannitol. Now, I've done these talks before, and I've said they're okay, and I've changed my mind. Because there was just a recent study to show increased risk of Colleen, was it heart attack with erythritol?
Increased risk of stroke.
Risk of stroke. Increased risk of stroke with erythritol. It was just released, I think, in March, that study. So, as far as I'm concerned, that the jury's out on these. I used to think they were safe. They mainly stay in your intestines, and the other downside is if you have too much, they draw water into your intestines and you end up with diarrhea. So this can be, for some people, this can be a cause of diarrhea. Yes, you have sorry.
Question on here. They asked is stevia okay?
Stevia is perfect. Stevia is the herbal sweetener, has no calories, and as an herb, it actually has a lot of health benefits. It helps regulate blood sugar. It helps regulate blood pressure. So stevia is the perfect sweetener in terms of if you need something to do that.
So what is erythritol in? What is it in?
You have to look at, it's in a lot of labels. You have to look at labels. In fact, Truvia is a stevia product. I think it's made by Pepsi. And the first ingredient on their label is erythritol, even though it contains stevia.
So are they sugar substances? Things that, like diet kind of things?
These actually have calories, but they're low calories. So these are sugars that your body doesn't absorb well. So they taste sweet, but they don't get absorbed and broken down like regular table sugar does. So they stay in the gut, they draw the water in, that's why they can cause the problem. But there are some that are absorbed, that's where the stroke issue comes into play. So, one more question?
They also asked whether monk fruit is okay. If you're not familiar, yes. It is.
I believe that has one of the sugar alcohols in it.
It's like stevia.
No, I think it's like erythritol or something, but I'm not positive. Does anybody know what's in monk fruit?
I'm not sure about monk fruit, but when you buy things that say monk fruit, they usually have erythritol with it.
Erythritol, okay.
It's mixed.
Okay, all right, I see. Okay, it's a possibility that erythritol is naturally occurring in monk fruit. I know it's naturally.
Buy it without it, like you can search monk fruit without erythritol, and there are
Oh, I gotcha. Okay, then
make it that way.
okay,
I guess read your label.
then maybe monk fruit is okay by itself.
Okay.
Okay. Okay, and then be sure to eat plenty of what are called fermentable fibers. That's part of the function of your good bacteria. They ferment good things and they give us energy, things like that. Flaxseed, beans, fruits, vegetables, and avoiding the sugary, high-fat foods. Natural approach to constipation, diarrhea. Again, there's the QR code to see the products. So this would help with someone who's on chronic things for constipation or chronic things for laxatives in a natural way. One is the probiotic, orthobiotic, 1 capsule at bedtime. There's powders for kids as well. For flaxseed meal, this would be, again, more people prone to constipation. A tablespoon with each meal for an adult. You mix it with soft food or beverage. It tastes like a seed or a nut. It's pleasant. You can even mix it into muffin mix or things like that. Psyllium seed would be what I'd recommend for people that are more prone to diarrhea. A teaspoon with each meal, again, adult dose. Again, mix it with any soft food or fluid. And then if you have cramps, mentholil, which is an enteric-coated peppermint oil. I mentioned peppermint before, can cause the esophageal sphincter to open and give you heartburn. Well, this has a coating that prevents it from dissolving until it gets into your intestines, and that's what helps to calm down spasms in your intestines. So you just take one whenever you feel you need it for intestinal cramps. And then the digestive supplement, complete digestive supplement, the betaine enzymes and bile, orthodigestzyme, one with each meal, and the dosing is the same as I mentioned before. You go up and down based on your symptoms. So sometimes we have diarrhea or constipation because we're not digesting food where it should be digested as it moves down the line. So if you need extra help, one of the things we specialize in is personalized nutrition and wellness counseling. As a nutritionist, I see people by private appointment. I help you to set your goals, realize your goals, reveal things that need to be dealt with. We track your progress over time, and there's a personalized, this is individualized for each person for diet and lifestyle guidance. And then I work with any health condition. Doesn't matter what health condition you have, medicines you're on, etc. The natural approach will always help without question. Oftentimes, over time, as you improve, your doctor can remove your drugs, that type of thing. And I also, as a pharmacist, monitor for drug interactions, what's safe to use with these programs. And it's really looking for hidden causes. People come to me, they say they're sick and tired of being sick and tired. They just don't have an answer. And it's amazing what you do when you look at the basic functioning of the body systems like this, for example. This will correct. If you have these problems going on in your gut, that could result in insomnia, depression, anxiety, skin disease, infections, bone thinning, Alzheimer's. I mean, you just go on because your system is not bringing in what it's designed to take in. So, overall, digestion and elimination are foundational to good health, and it is well worth your effort to make sure that you're working as hard as you can to maintain a healthy balance here. And as we like to say here, it's easier to stay well than get well. So next time we'll do a talk, May 13th. We're going to, actually Lena will be doing the talk on stress and anxiety, relieving stress and health and wellness. And so let me just mention to TikTok watchers, all the resources and products and things that we've talked about today, and slides for the printouts for the PowerPoint, they're all available in our link on bio. And thank you for watching.